Hey everyone, this is Miss Pfeiffer, and today I'm going to be talking to y'all about quality improvement in nursing. All of this information is going to be coming from Chapter 18 of your Leadership and Nursing Care Management textbook. So let's go ahead and get started. So to get started, let's first introduce some quality and safety key terms that I'll refer back to as we go through this presentation. So quality, safety, and standards. Healthcare quality is the degree to which healthcare services increase the likelihood of desired health outcomes and are consistent with current professional knowledge. Safety involves minimizing risk and harm to patients during healthcare delivery, and standards are written value statements that form the rules that apply to key processes and the results that can be expected when these processes are performed according to set specifications. The American Society of Quality defines continuous quality improvement, or CQI, as a philosophy and attitude for analyzing capabilities and processes and improving them repeatedly to achieve customer satisfaction. So, this is a continuous process. It's not something that starts and stops, it is something that management and leaders in healthcare facilities are constantly looking at in regards to areas where they can improve customer, or in this case, client satisfaction. A performance or quality improvement program is an overarching organizational strategy to ensure accountability of all employees. It incorporates evidence-based healthcare quality indicators to continuously improve care delivered to various client populations. Patient safety practices are a type of process or structure whose application reduces the probability of adverse events resulting from exposure to the healthcare system across a range of diseases and procedures. So this would be an example of when you go in to administer a medication. A patient safety practice is to verify that you have the right patient by having them verbalize their name and date of birth to you. A lot of facilities also nowadays have barcodes in which you have to scan the patient's wristband to again confirm that you indeed are with the right patient before performing any sort of patient care, such as medication administration. A high reliability organization is an organization operating in an industry that has a high risk for harm that consistently performs at a high level of safety over long periods of time. And when you think about the healthcare industry in general, and all the tasks that nurses in a hospital type setting perform, that is an industry in which there is a high risk for harm. But we hope by implementing appropriate patient safety practices that that specific hospital is going to consistently perform at a high level of safety and not really have any adverse patient events like administering a medication to the wrong patient or something like that. So performance measures and risk adjustment. A performance measure is a quantitative tool. So an example of a quantitative tool is something like a ratio or percentage. Quantitative means something to do with numbers, basically. And that quantitative tool provides an indication of an organization's performance in relation to a specified process or outcome. A performance measurement system is a systems-based approach to quality and safety where the organization uses evidence-based medicine and clinical decision support tools. It engages in performance measurement and improvement, measures and responds to patient experiences and satisfaction, practices population health management, and publicly shares robust quality and safety data and improvement activities. And lastly, risk adjustment is a process in which differences among clients or variables, so an example of this would be client's age, are adjusted for outcomes analysis. So when you think about taking care of the pediatric population versus the elderly population in regards to cancer care, obviously the outcomes for the pediatric population and the elderly population are going to look very different. So risk adjustment keeps that in mind when sharing the available data so that they can ensure that the patient safety practices that are implemented are targeted for that specific population. And lastly, sentinel events. So by the looks of this dog's face, sentinel events are not a good thing. And a sentinel event is a patient safety event that reaches a patient and results in any of the following: death, permanent harm, or severe temporary harm that requires intervention. And such events are called sentinel because they signal the need for immediate investigation. And we're going to talk a little bit more about sentinel events later on. So now let's talk about quality, safety, and standards. So standards of quality. In 1980, Donabedian developed the initial model of healthcare quality standards and identified that quality can be measured with these three aspects: structure, process, and outcomes. And remember, standards are written value statements, and in this case, they're essentially going to find quality against which performance and outcomes are measured. So what is put in place to ensure that nurses are performing at an acceptable level, as well as those nurses' performance are ensuring positive client outcomes in the healthcare industry. So first, let's talk about structure, standards, and measures. So structure, standards, and measures focus on the internal characteristics of the organization and its personnel. So an example of this would look like in an ICU, structure standards may address whether there are enough intensivists or physicians that specialize in intensive care medicine to ensure quality health care. Another example of structure standards could be something as simple as looking at nurse staffing ratios to make sure that they have enough nursing staff to adequately care for the patients on that specific unit. Next is process standards and measures. So process standards and measures focus on whether the activities within an organization are being conducted appropriately, effectively, and efficiently. So an example of this would be ensuring that advanced practice providers such as nurse practitioners, physician assistants, physicians are following the appropriate clinical practice guidelines when it comes to prescribing medications. And process standards and measures relate to what the nurse will be doing and the process the nurse needs to follow to ensure effective evidence-based care. So when we're talking about the role of the nurse specifically when it comes to process standards and measures, nurses can look at the overall unit workflow. What could potentially be improved to allow nurses to perform quality medicine effectively and efficiently while promoting positive client outcomes? And last but certainly not least are outcome standards and measures. So outcome standards and measures refer to whether the services provided by the organization make any difference. So outcome standards basically aim to answer the question, were the services that were provided effective? So an example of this could be the percentage of clients who actually stop smoking after enrolling and completing in a smoking cessation course. So we are looking at a class or intervention that was actually implemented and the specific outcomes that were related to that specific class or intervention into how effective it was in meeting the objectives of that specific process. So now let's look at some different quality and safety performance improvement models. So the first one is called Six Sigma, and Six Sigma is aimed to reduce variation in error rates. It's achieved when an organization reaches an error rate of 3.4 or less per 1 million. And some examples of Six Sigma when applied into the healthcare setting specifically are reducing the number of errors made by healthcare workers, improving lab turnaround times, reducing appointment wait times, and improving patient outcomes. And you need to keep in mind, while those sound like simple objectives to meet, there is a lot of changes that could potentially have to be made within a hospital setting in order to improve a lab turnaround time or reduce appointment wait times. So there's a lot of data that must be examined when Six Sigma is utilized to hopefully reduce error rates and improve quality care. The next model we're going to talk about is Lean, and Lean is a model of quality measurement that emphasizes waste reduction and efficient workflow. So the basis of this model is that operational waste in an organization needs to be completely eliminated if possible. So an example of a lean in healthcare would be improving supply chain management or improving medication administration processes so that you're not going into a patient room, have already opened the medications that you're administering to that patient, and then right before you give the patient, say, an oral tablet for them to take, they refuse that medicine, and therefore that tablet is now wasteful because we can't reuse medicines once it's been opened in a client room. So that's an example of a lean when it comes to how that would look specifically in the healthcare setting. There is also an award called the Baldrige National Quality Award, or the BNQA. And the BNQA established a set of performance standards that define a total quality organization. And it's based on the following 7 areas of excellence: leadership, strategic planning, customer and market focus, information and analysis, human resource focus, process management, and business results. All right, so I know this is a review because we've already talked about the basic definition of high reliability organizations, or HROs, but who remembers what an HRO is? So give y'all a hint, it's back on slide 4, but I'll go over it again with y'all. An high reliability organization is an organization operating in an industry that has high risk for harm that consistently performs at a high level of safety over long periods of time. And high reliability organizations ensure that potential problems are anticipated and that strategies are in place if an unexpected event occurs to minimize potential consequences. So this is anticipating potential problems that could arise in the healthcare industry, and making sure that there are set standards and models in place to minimize that event from happening and to therefore also minimize any potential consequences as well. I know we talked about magnet designation a little bit in the leadership lecture as well, but I'm going to revisit it with y'all again, just as review. So remember, the magnet designation encompasses the American Nurses Credentialing Center, or the ANCC, and magnet designation recognizes healthcare organizations for aligning their strategic goals to improve the organization's outcomes. Magnet designated hospitals tend to attract and retain staff due to the focus on nursing leadership and evidence-based care. So this is going back to that leadership presentation. We want to build an empowered nursing team, and that starts at the top with the nursing leadership and nursing management. And that's why it's so important to have effective leaders in place that can help promote that empowered nursing environment and workplace. And remember, the magnet model includes the following components: transformational leadership, structural empowerment, exemplary professional practice, new knowledge, innovations and improvements, and empirical quality results. The last thing we're going to talk about in this section of the presentation is the Planetree Model of Care. And the Planetree Model of Care designates healthcare organizations for person-centered excellence. So it proposes that person-centered care yields internal, external, financial, and cultural benefits to healthcare organizations. And this model of care engages patients, it promotes population health, and improves organizational performance in quality, safety, and experience. So basically, the Planetree Model of Care is promoting individualized nursing interventions and individualized plans of care. And this goes back to patient and family-centered care. We want our patients and their family members to feel like they are engaged and active in making their own healthcare decisions. So the Planetree Model of Care focuses on that and wants patients to feel empowered when it comes to their healthcare decisions. So now we're going to look at some current issues and trends that are specific to quality and safety in the healthcare industry. So let's first talk about costs associated with waste in healthcare. And real quick quiz. Do y'all remember what quality improvement model aims to reduce operational waste? So the quality improvement model that aims to reduce operational waste is a lean. And it's important to remember that because look at all these statistics. This is wild when you think about waste in healthcare. So cost associated with healthcare waste ranges from $760 to $935 billion annually. This equates to about 25% of total healthcare spending. And there's different ways that healthcare waste can be categorized, and some examples of this include failures of care delivery, failures of care coordination, over-treatment with medications, administrative complexity, pricing failures, or healthcare fraud and abuse. So now let's talk about mission, vision, and core values, because this is something that is being implemented more and more nowadays in healthcare settings. So a mission is a concise statement that answers the questions, what business are we in today? Whereas a vision statement is a concise statement that accurately explains what the organization is striving to become. And it's important that both mission and vision statements are communicated widely and effectively to both internal and external stakeholders within that organization. So an example of internal stakeholders in a healthcare organization would be nursing staff, and an external stakeholder when it comes to a healthcare agency could be something like a insurance company. And lastly, core values are statements that frame the organization's culture in the same way mission and vision statements do. And so it's important that all of these components, mission statements, vision statements, and core value statements, remain constant despite the always changing healthcare environment. So now let's talk about some examples of these to kind of help y'all be able to differentiate them. So mission statements aim to answer the question, what business are we in today? So a simple mission statement could be something like, to improve the health of those we serve with a commitment to excellence in all that we do. Now, when you think about how that may differ from a vision statement, remember a vision statement is accurately explaining what the organization is striving to become. So a vision statement is more so trying to look towards the future and almost describe an even bigger goal. So an example of a concise vision statement could be to be the best health system in the universe. And lastly, with core values, these are going to be different for every healthcare agency because every healthcare agency has to define what they want their culture to be. And we need to remember that values are operational qualities that are used by organizations to maintain or enhance performance. And values consciously and unconsciously guide a professional nurse's personal and professional behavior. So this goes back to knowing those nursing values, because remember, it's something that is going to define you both as a professional nurse and as a professional young adult as well. So core values are something that are important for both you to be able to identify for yourself as an individual, but also it's important that whatever healthcare agency that you choose to work in one day has these core value statements as well to help define the overall culture within that organization. So remember I told y'all we were going to circle back to sentinel events. And so remember, a sentinel event is an event that can result in patient death, permanent harm, or severe temporary harm that requires intervention, and they require immediate investigation. So sentinel events trigger comprehensive investigations to identify root causes and overall improve safety processes within an organization. Learning from these incidents is crucial for developing effective interventions and preventing future occurrences and ensuring a culture of safety is maintained within that organization. And we're going to talk a little bit more about how sentinel event investigation happens and some considerations to keep in mind with this coming up in just a little bit. So why is it important that we talk about quality and safety today? Well, ongoing education for nurses and nursing students about quality and safety is vital for improving patient care. Incorporating quality improvement principles into nursing curricula and professional development programs equips nurses with the necessary skills to enhance patient safety. And, I know it may seem like a long way away right now, but y'all are going to be getting ready to go to the hospital for clinicals and being hands-on with patients very soon. And patient safety is one of the biggest things that we want y'all to promote and advocate for. And so being aware of some processes and models in place to help facilitate that, it's important that y'all are already familiar with that before going into these settings so that you can help promote that culture of patient safety and therefore hopefully improve patient outcomes as well. So now let's look into patient safety a little bit more. So why is it important? Your textbook actually has all of this in box 18.5. I provided a copy of it here for you to look over, but there is a major national focus on the safety of healthcare systems and processes. 98,000 healthcare deaths were considered preventable. That automatically says that there is room for improvement when it comes to patient safety in the healthcare industry. So we as nurses need to be able to identify areas of improvement. Healthcare or patient safety has now become a key component of the accreditation process, and there's actually new standards set by the Joint Commission or the TJC and other accrediting agencies to address the issues of safety within healthcare organizations. And again, here's that copy of box 18.5. It's on page 368, but we definitely want y'all to look this over to see what does safety look like within a healthcare organization. So there's also some national patient safety goals that were originated by the Joint Commission in 2002. And these goals represent the most commonly occurring and or serious events from the Joint Commission Sentinel Events database, combined with the recommendations of an interdisciplinary task force. Each goal has evidence-based recommendations explaining how to implement the goal successfully. National patient safety goals are reevaluated every year and new goals are added if necessary and or potentially existing goals are replaced. Each healthcare organization must demonstrate compliance with all applicable national patient safety goal recommendations during their accreditation survey. And a full copy of these goals, I attached a link on this slide if y'all would like to review that. But basically, the takeaway in regards to national patient safety goals is it's something that the Joint Commission formulates based on the Sentinel event database, because if a Sentinel event occurs, that is something that must be recorded to accreditation agencies, because the overall goal of an accreditation agency is to promote quality healthcare and promote patient safety. And so anytime something like a Sentinel event happens, you know, there are specific steps that must take place in regards to reporting that event so that accreditation agencies like the Joint Commission can formulate these national patient safety goals, and by doing that, improve the overall patient safety aspect and patient safety culture within all healthcare agencies in which it provides that accreditation process for. So talking about that accreditation process, let's talk a little bit more about accreditation and regulatory influences on quality and safety. So again, quality and safety are critical aspects of healthcare delivery, and healthcare organizations are required to meet standards for federal and state reimbursement. So when I say federal and state reimbursement, I'm specifically talking about Medicare and Medicaid. Private accreditation processes like the Joint Commission have had the most significant impact on healthcare because those are the committees that are formulating these national patient safety goals like we just talked about. The Joint Commission has changed the focus of their standards from quality assurance to process or performance improvement, or you may see that abbreviated as PI. And performance improvement establishes that quality initiatives in the organization were no longer the responsibility of a single person or department, but instead the responsibility of the healthcare organization's leadership, which again is why having an effective leader in place is so important when it comes to the healthcare industry. So now let's talk about healthcare enterprise risk management, or ERM. So ERM in healthcare promotes a framework for making risk management decisions, which maximizes value protection and creation. An ERM program includes components of culture, strategy, objectives, appetite and tolerance, ERM structure and plans, and oversight. And here is a copy of another table from y'all's book that kind of further breaks down all of these components that I just mentioned. And one of the biggest things to keep in mind when formulating objectives is that they are SMART. And I know Ms. Wheeler has talked to y'all about that in teaching learning when y'all were formulating your learning objectives. But always remember that you need to make sure that your objectives are measurable so you can measure them. We want that data to be able to improve processes. And so if we set objectives in place that we cannot measure, we're not going to be able to get that data to know whether or not whatever was implemented was effective or not. And here's a review of what exactly a SMART goal is. Remember, it's specific, it's measurable, attainable, relevant, and timely. So let's talk a little bit more about how we report those patient safety events. And most often it's done through an incident or variance report. So this is going to be something that wasn't necessarily a sentinel event. Maybe it didn't cause permanent harm or death to a patient, but it was something that could have potentially caused harm. And so even incidences like that need to be reported. So an incidents or variant report is a tool for ongoing risk identification and reporting, and this report provides factual explanation of a patient safety incident or adverse event. So some key attributes of an effective incident reporting system include an organization that fosters a supportive environment for event reporting, because think about it. If you're concerned about being reprimanded for reporting an event, you're probably not going to be likely to report it out of fear of, potential punishment. So it's important that wherever you work fosters a supportive environment and encourages its staff to report this type of incident specifically. Also, reports should be received from a broad range of staff. So it should not be limited to, just the nursing staff, janitorial staff, all the way up to nursing leadership, and the chief executive officer of that facility should be able to report and file an incident or variance report. The summaries of the reported events must be reviewed promptly and timely, because again, if something like this is filed and it's not reviewed promptly, there's potential risk that that exact same thing could happen again. And lastly, there needs to be an appropriate system implemented for reviewing these reports and developing action plans. So not only do the reports need to be reviewed promptly, but they need to be able to have the appropriate people in place to review them to help develop those action plans to hopefully prevent that from happening again. And data from these reports are analyzed and used by nurse managers and risk managers within a healthcare facility to identify areas that have a high risk potential or point to an area that has emerging risk potential. So patient safety event reporting specific with sentinel events. I know we've already talked about sentinel events, but if you don't remember what it is, go back to slide 6 and look over that definition. And remember, the Joint Commission requires that healthcare organizations respond to sentinel events in a systematic way, often through root cause analysis or RCA. And accredited healthcare agencies are also expected to implement the process of healthcare failure modes and effects analysis, or HFMEA. So let's talk a little bit more about root cause analysis and healthcare failure modes and effects analysis. So root cause analysis is a systematic approach to identifying the underlying problem, and it's often done using flowcharts or cause and effect diagramming. So it's basically, it aims to get to the root cause of why this specific event happened. Where did the break in the system take place? The healthcare failure modes and effects analysis is a method of proactive risk assessment. This is going to be something that occurs before an actual incident takes place. So again, this is something that healthcare agencies put in place to be proactive and hopefully prevent patient safety events. And some specific examples of sentinel events could be surgery performed on the wrong site. And that's why before surgery takes place, everyone in the operating room is required to do a procedure called a timeout, where you're verifying that it's the right patient. You're verifying the surgical site, and the surgical site must be marked by the physician. Those are specific safety processes in place to hopefully prevent a sentinel event from occurring. Another example of a sentinel event would be a blood transfusion that results in temporary harm, permanent harm, or death. Maybe, a patient's type and cross, which is a procedure that confirms that they're getting the right kind of blood based on their blood type. Maybe that was not done properly, and therefore a sentinel event occurred. So these are events that we do not want happening because they injure our patients. And in certain cases, they can even cause patient death. So it's important that we have these event reporting systems in place so that we hopefully never get to a point of having to report an actual sentinel event. So again, educating nurses about quality and safety. There's a quality and safety education for nurses, or QSIN. You will hear us refer back to this throughout the program, but it is a comprehensive resource to help new healthcare professionals learn the necessary knowledge and skills to lead and support quality and safety initiatives. Because like I said, it's not going to be long before y'all are out in the hospital and clinicals and y'all are going to graduate from this program. And it's important that you always, always advocate for your patients. And one of the biggest and best ways to do that is through having the necessary knowledge and skills in place to be able to identify a potential patient safety event. And remember, nurses and nursing students play a vital role in improving quality and safety of patient care. Again, always be an advocate for your patient and never be afraid to speak up. So that is the end of this lecture. I hope y'all found it helpful and informative. If you do have any questions for me, please feel free to send me an email. Thank you.